In today's Health Watch, it's American Heart Month, and it serves as a good reminder to check on your heart health, especially for women. Heart attack symptoms are different from what a man can experience, and here to help us is Dr. Renaria Pitts. She is a cardiologist with Aurora Denver Cardiology Associates. Thanks so much for joining us.
Yes, thank you for having me.
Okay, so let's get right into it. Can you tell us the different heart attack symptoms for men and women?
Yeah, women can present differently. Typically for men, we know of the crushing chest pain, the heaviness of the chest, but for women it can present as nausea or shortness of breath or even just fatigued. So you just never know, and you have to know your body, know if something doesn't feel right, and if something doesn't feel right, you should seek medical help, talk to your doctor, talk to a cardiologist.
So listen to your body, right? Yes. What can people do to prevent heart risks?
Yeah, American Heart Association emphasizes life's essential 8. So there are 4 lifestyle modifications like not smoking, eating well, a heart-healthy diet, exercising, and also getting good sleep. There are also 4 other things that you should talk to your doctors about: what your weight or your BMI looks like, what your blood pressure looks like, what your sugar levels look like, and what does your cholesterol look like. So all of these 8 factors really play a role in what your cardiovascular health is and how you can better improve it.
So we know the weather in Colorado, it's hot and it's cold, and even in the winter months when it snows, we've done stories about the dangers of shoveling, and sometimes people have these they could have a heart attack. It can really put a strain on your heart. So what are some of the tips where we can safely stay active, but also be safe to our heart?
Yeah, I mean, we're fortunate here in Colorado where we don't get snow all that often, or if we do, it really melts so pretty quickly. So take advantage of those days where the ground is, safe to walk. And I would say walk every night, walk in the morning. Any movement is good movement. So take advantage of the good weather days, of course. And then we have great recreational centers out here. YMCA, they have great programs and silver sneakers for our elderly neighbors and friends.
So you mentioned sleep can really help with heart health. What are some of the sleeping habits that are good and some are bad, and how can we get better?
Yeah, everyone can get better at sleep for sure, but we recommend at least 7 to 9 hours of sleep a night. And obviously trying to wind down before bedtime. Don't be on your phone just right before you get to bed, but have that 30 minutes of quiet time right before you hit the bed.
The sweet spot of time to sleep? What's the good one?
7 to 9 hours.
7 to 9 hours.
Sleep at night.
Okay, I'm trying.
I know, it's hard, especially for you.
Yeah. Well, thank you so much for joining us, Dr. Pitts. Thank you. And remember, you can watch this interview and all of our Health Watch interviews on our website, cbscolorado.com. We'll be right back.